I forget what I'm supposed to do.
The end,
I do this every time.
The end of the first one.
The end of the first one.
Yeah.
Okay. What?
We need a drink.
We do the bloopers.
Where's the
Yeah.
Sorry.
Okay, let's try again.
Sorry for Saying Sorry Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Yola Kerpenstein, talented surgeon and social media geek.
Hi, this is Dr. Susan Little.
And this is Dr. Yola Kerpenstein, and this is the Purr Podcast.
It is, and where are we, Yola?
We're in Chicago.
Oh, the beautiful city of Chicago.
And the
Where
sun
it's
is
sunny,
shining.
which makes me happy, because I come from the land of the frozen north. So sun is always a good thing.
Are you behind the wall or before?
That depends on your viewpoint, I think. Yes.
Do you
that
have
depends.
dragons?
Do we have dragons?
Yeah. Oh, she doesn't watch Game of Thrones.
Oh,
obviously.
my gosh.
You are not
Neither
watching
do
Game
I.
No way.
No. So everybody in my house watches Game of Thrones
Yeah.
except me.
Yeah.
So what I do, so I hope my son isn't listening. I hope Ben isn't listening, because here's my mom tip if you don't watch Game of Thrones.
Yeah.
So I just check social media in the morning.
Yes.
Right after the Game of Thrones episode,
Yes.
to see what was the current controversy, so I can actually have a discussion with my son.
See, I don't care and I don't pretend to care. It's like Fortnite. I don't care and I don't pretend to care.
I don't even care.
Nope.
Right.
I just,
All right.
nope.
You know, there are no cats in Game of Thrones, so that is a major
Well, there you go.
negative point.
I knew there was a
of
reason I
that
wasn't
show,
watching it.
But do
might
you watch any television? Let's introduce
Wait,
yourself.
no,
Sorry.
back
What?
up. This
Oh,
might be the
back
first
up.
time.
Yeah.
Is it the first time we've had two Susans? As we both think frantically.
What?
Two Sues.
Oh,
the show.
Sue.
Sue.
You didn't even make the connection.
No,
No,
hello.
I'm talking
We've-
Susan.
We've never had two Yolas, that's
No, but
for
I
sure.
mean, no, we had a Joe and a Yola.
Oh,
That's the
doesn't-
same thing then.
Joe is his Starbucks name.
Yes, Joe
Yeah,
Kerp.
it's his Starbucks name. Yeah, everybody. Well, not everybody, but
They
some
don't,
people.
They don't misspell Joe.
That's. So I think, is it, or did we do? No, we maybe have had the other Susan Little.
We didn't have the other Susan.
Not
Little
yet.
No.
You're the first
Yay.
Sue
Yes.
guest. Okay.
Dr. Sue.
Yeah, the first Dr. Sue guest. Okay,
So
now you
Dr.
better
Sue
introduce
came- yeah,
yourself. Yeah.
That's it.
After all that, you better introduce yourself.
I'm Dr. Sue Ettinger. I'm a medical oncologist in the New York area.
And
And
what do you do?
what do I do?
Yeah.
I treat dogs and cats with cancer, and I'm also known as Dr. Sue Cancer Vet.
Yes.
And I'm passionate about raising cancer awareness, both with pet owners and with veterinarians, so we can treat pets, diagnose them earlier so they can live longer and live well with cancer.
And she's all over social media.
All over social media. My husband, while he's watching Game of Thrones, I'm on social media. He often calls my social media accounts my boyfriend. 'Cause I spend a lot of time.
It's your work
It's
boyfriend.
It's my work boyfriend.
Yeah.
I spend a lot of time. It's a passion, but it definitely cuts into our time.
But I have to say, because we know each other a little longer, and you have been... How long has your social media career been? When did you start? When was the first time that you...
So I co-wrote the Dog Cancer Survival Guide.
Yeah.
Came out in 2011, and then I did a website, and then that's when I did Facebook. So it was like 2012, but I don't think I really started to do it consistently for about another year or so. So probably been doing it 5-6 years,
Yeah.
and to me it's like exercise. It's you just have to do it every day. It's consistency. It's you're not just going to do it a little bit here, a little bit there. It's just something you have to consistently do to be successful at. And I just think that's the key, is just consistently working at it day in, day out.
And what I like about you is that you also challenge yourself. So you innovate in the things that you do. So you start a vlog, you do all these new things that you either see other people do or you hear about, and then you try it yourself and put your spin to it. That's pretty awesome, I think.
Yeah, it's been an interesting journey. I don't think that when I went into private practice, when I finished my medical oncology residency, I would have any idea that I would be doing social media, that I would be speaking, that I would be lecturing, that I would be vlogging, that I would be storytelling, that I would be trying to reach other people outside my geographic area. So it's been a fun, exciting journey, a little bit overwhelming at times, but I feel blessed to be able to do what I do on a daily basis.
Yeah, and I think you're also probably part of the group of social media veterinary pioneers that is there. So it's not a really big group, but it's increasing because I see more and more young people doing the same things, which I think is amazing. So I think that and there's very few people that talk about oncology the way you do and make it accessible for everybody.
Yeah. When did the see something, do something start? When did you start that?
So that the years start to blend.
I know.
So I think it was probably around 2014. So I was in private practice in Westchester, just north of New York City, running an oncology service. The book had come out. I was doing a little bit of social media, but my head oncology nurse, Amanda, she had this wonderful white pitty. He was about 12 years old at the time, smoky, and he had a bunch of benign lipomas that we had aspirated over the years. And she found another lump, and she said, "Dr. Sue, can I bring him in? I think I found another fatty tumor." And she brought him into work all the time because he had all these other medical conditions that my husband, an internist, had taken care of. So he had Addison's disease, he had an arrhythmia, had kidney disease, he had been on the MRI truck, we had a truck outside the hospital, so he had lots of diseases. He came to work all the time because he was just an older dog and we were allowed to bring our pets. And it was one late day and she said, I said, "Go get Smokey." And she said, "Meh, I'll just do it another day." So about a week or two later, I stick a needle in this mass and it turned out to be a soft tissue sarcoma. And it was a 7-centimeter mass. It was a low-grade soft tissue sarcoma. We ended up getting clean and wide margins. We aspirated it. We biopsied it first. But it was this flank mass, and it required this huge surgery, and the surgeon had to do a flap, and the flap broke down, and it dehisced, and it looked like it wasn't going to hold. And I thought to myself, because it took weeks and months for this thing to heal, like, how did I fail this dog that was in front of me? And so, this morning, I talked about failure, first attempt in learning. This was a huge failure for me. I was like, how did I miss this lump and bump in this dog? I claimed in my mind to be someone of early detection. And I went back to the books, and there aren't really good lumps and bumps. There wasn't a good protocol for lumps and bumps for dogs and cats. There's the one for soft tissue sarcomas, for vaccine-associated sarcomas, but most books say if lumps and bumps are growing, irritating, or bothering the patient, that you should do something. But nobody, pet owners or veterinarians, really know what that means. And we all see these lumps and bumps that come in like half the dog or cat's face, or wrapping, or mast cell tumors that are wrapping around the cat's legs, or soft tissue sarcomas that are wrapping around the legs of pets. And I said to myself, we just have to do something better. And that's where the program came from. So I started emailing some other oncologists and got surgeons involved. And I was working with VCA at the time, and we put together the program. So to me, it came from this. And Smokey, to me, was like my stepdog. I love this dog so much, and I felt like I failed him, and he's now an inspiration to help so many other dogs and cats. So that's where the program came from. But when I tell other pet owners and I tell other veterinarians, I was like, guys, this is me sharing to you, like, one of the biggest failures for me as a veterinarian. Like, how did I miss this lump and bump? But the point was, we got complacent because all of his other lumps had been benign. So that's where the program came from.
Yeah. I love that you took something that I'm sure broke your heart.
Yeah,
at the time,
because it took a long. The pictures. The surgeon Jen Bonzinski, who is phenomenal. She took a flap of skin from the cranial thigh and moved it up to the flank to fill the deficit. That's how huge this was, and she got margins, but it broke down. It did eventually heal, but you can look back now and be like, oh, it healed. But day in, day out, this dog that was an Addisonian with kidney disease and arrhythmia, like, it was...
It could have gone down from any one of those cumulative issues. So I do love that you took something that, again, I'm sure was heartbreaking to go through. And it wasn't just a day of heartbreak. It was weeks, I'm sure. But turned it into something that I'm also sure saved lives.
Yeah.
Right? So.
And the cool thing about social media, what I love about it, is I get messages from people in England or in California or in Australia that say, I went to my vet And because of your program, I told them to stick a needle in the mass. Like, they know why weight aspirate. And sometimes a veterinarian isn't aspirating. So that's why I really want to educate pet owners, and I want to educate veterinarians. And for the vets that aren't aspirating, I say, it's not your fault, because we didn't know there hasn't been guidelines, but now there are guidelines. So, but change is slow. And so, that's one of the reasons I get out there and lecture, and I use any opportunity, if it's a podcast or an article, to share this information. But it is super exciting when someone from Australia sends me a message that they went to their vet, and their vet aspirated, and their dog had a mast cell tumor, or their cat had a soft tissue sarcoma, and they got clean and wide margins on the first time because they knew what it was.
Yeah.
I think it's nice because you create demand for the end user towards the vets too. So it's not only that you're targeting the vets to learn more, but you're also targeting the end user, which is the consumer, which is the client, to be vigilant about this, which I don't think that we as oncologists, surgical oncologists, medical oncologists, teach them well enough to do. I do it when they come into the clinic and they have a tumor. I tell them, from now on, we have a very close relationship. I want you to see you at any time when you feel something abnormal, but we don't do it before that. So I'm not, every client that I see, I'm not teaching, okay, this is the way how you have to do it, and you need to call me from now on. Yeah. And I think that's what you're doing. And
I think we're making the job easier for general practitioners if the pet owner is informed and they can help us find it earlier. And I realize I probably owe you guys a lot of drinks because I said the D word many, many times.
It's a bottle.
But it's okay. but I think, that's the one thing that I think social media and this experience has taught me is it's so important for anything to be successful is that we're educating the pet owner and educating ourselves as veterinary professionals. Because for anything to be successful, because we can all be super smart as veterinary professionals, but if the pet owners aren't engaged and on board, it's not going to work. And it's the same thing if you have super engaged pet owners, but the veterinary profession's not on the same playing field. You know what I mean? Like everybody's got to be working together. And so that's sort of been the fun part about doing social media and talking to veterinarians at conferences is you get to learn from everybody and work together. And that's been really fun.
The flip side to that is that there is a lot of misinformation on social media too. And you probably have to deal with that every day.
Every day. Yeah. And I've tried to use social media as a positive experience, and I've also tried to turn it off at times, which is hard. And I've tried to create a positive site to educate. And I don't always go to the other sites. I don't like sites that are complaining about veterinary medicine or clients complaining just in general. And over the years, there are times I'll send stuff to Caitlin, who helps me with my social media, and she'll be like, ban and block, because somebody will make a really negative comment either about me or just treating cancer in general. And she's like, and I was like, but free speech. She's like, honey, this is your site. Like, she's like, you don't need to, or somebody
she's
will,
right.
Someone will curse at me.
It's your house.
Yeah.
It's your house. You don't have to tolerate it.
She's like, somebody can't call you the B word on your site.
In your house.
Yeah, in your house. She's like, so I've tried to just, be positive about it, or someone doesn't understand chemotherapy, or people still say, oh, you're poisoning them with chemotherapy. Why don't you try herbs only instead? And so it's gotten easier over the years, and I think, and I take it a little less personally.
So speaking of like myths and misconceptions, there are a lot of myths and misconceptions about cancer in pets in general, but I often feel that cats still get the short end of the stick there, right?
Yeah, and I think, one of my nurses was more inclined towards cats, and she would always get so frustrated that there was less information about cats versus dogs, just in terms of, she would always go to Withrow McEwen, right, which is like the oncology book, and she would be like, for different tumors, she'd be like, why is there 50 pages for dogs and 20 pages for cats for the same tumor?
Or a paragraph.
Yeah, or a paragraph. If it was an uncommon tumor, she'd be like 10 pages for dogs and 2 paragraphs for cats. So, she called them like the wicked stepchildren, right? Or the orphan stepchildren.
Orphans.
They were just less information. So I think we often have less information about cats. The good thing about cats with cancer, did I just say that, is they but the one thing that most people don't know is, I say to clients when I'm in the room of dogs, cats, and people, who's going to tolerate chemo the best. And the good news is that cats tolerate. And you always think, well, they're these small little creatures, but man, they tolerate chemo the best. And I think that is one of the myths and misconceptions that people don't know. But I do feel frustrated that we often don't have as good studies about them, and we don't have as much information. So it's hard to prognosticate about them. It's hard to just, either help veterinarians or pet owners often through the decision-making process.
Mm-hmm.
I'm Dr. Sue Ettinger, also known as Dr. Sue Cancer Vet, and I'm so excited to be sponsoring this Purr podcast. Please be sure to check out my website, Dr. Sue Cancer Vet, and also my YouTube channel. Also, amazingly, Dr. Sue Cancer Vet, where you can find tons of information about cats and the other species as well. And you can find information about cats and dogs going through cancer, with information about chemotherapy and the different tumors that we see and treat in dogs and cats, and how we can kick cancer's butt.
I think in some ways we're doing better in all of the ancillary parts of getting a cat through chemotherapy. So there's the issues of the specific tumor and the specific treatment, but we're also doing better at the supportive stuff.
Right.
Supporting your appetite, controlling nausea, controlling pain.
I mean, I'm just excited that Meritaz just came out, right? I mean, so we finally have an appetite stimulant for cats that we don't have to pill our cats for, like
transdermal.
Yeah, transdermal. So when my cat had IBD that became lymphoma, Jeter, who we lectured about, I couldn't pill this cat, and I'm a veterinarian, and so when we talk about not being judgy with our clients, like he knew, like at first he loved his chicken flavor prednisolone, but then he knew in the evening that when I went to the fridge, he ran. So I used to like go to the refrigerator and sneak it under like my sweatshirt, go in the laundry room. And I was like, oh my God, this is what pet owners do.
This is what they do.
Yes.
And then when there was one medication that we couldn't get compounded, and I was like, and my husband's like, we have to pill him? So thank God, so I do think like the fact that Kindred Bio has developed a transdermal FDA-approved medication to help cats gain weight by stimulating their appetite.
Oh, it's huge.
It's huge.
Yeah, there's nothing more humbling than having, my husband's a veterinarian too, than having you and your husband realizing neither of you can pill the darn cat.
Yeah.
Right? And if we can't.
I have my 7-year-old going one direction and my 9-year-old, and we're all trying to chase the cat. Like, and this is just one time, right? You're like,
and there's like 30 days to go. Yeah. So I think we're getting better at getting that type of support, right?
Right.
And we're now also you expect your 90-year-old client.
Oh, that's
with
right.
5 cats to pill
to do
all
it.
of our cats. 3 pills a day.
Yeah. So because a lot of the battle around cancer and chemotherapy in cats, probably in the other species too, but especially in cats, it's all the supportive stuff, right? It's making sure that they're eating, that they're that they're feeling okay, that they're not feeling nauseous. That's a big part of the battle as you're going through the whole experience. So the more we pay attention to that, and the better we do with that. And to some degree, I think that's been underestimated. I think veterinarians who have been treating, let's say even lymphoma, which is number one cat cancer, and a lot of veterinarians have some degree of experience with treating lymphoma, all focused in on the cancer and the specific drugs, and like traditionally didn't think much about the other stuff.
No,
it makes a big difference.
And I think a lot of the times, many cats are in multi-cat households, and I had 2 cats, and I tell a story about when Jeter, our cat with IBD, it wasn't until our other cat passed away from kidney disease that we realized we were blaming the vomiting on Jeter, and we realized once the other cat passed away from kidney disease that vomiting that we thought was Jeter's IBD getting worse again was really the cat with kidney disease. Yeah. And I was like, like how confusing it is. And, and I also, like, our cat losing weight was, noticed by my mother-in-law. So, I think you learn a lot about being
and you stop judging.
You stop judging. I think you're a more tolerant veterinarian when you've had some really bad experiences with your own pets.
Yeah.
And I think cats can be humbling, killing them
every day,
figuring out weight loss, figuring out appetite, especially if you have a multi-cat household. It's not as easy as just taking a 5-minute, 10-minute history, in the exam room and just saying, how's the appetite? You really sometimes have to probe much more deeply to figure out, things like sometimes, I talk about with other veterinarians, like the owner may tell you the appetite's good, but they're hand feeding. Like that's not a good appetite, but the owners will tell you good appetite.
Or they think it's good because they saw him go eat,
right?
But did he eat enough?
Right.
Yeah.
And so they're still losing weight. So it's tricky.
Yeah, cats definitely make it tricky, that's for sure. And you're right, they are definitely humbling. But I do think that we're making strides, I hope, anyway, in a better understanding of cats and a better understanding of how to support them when they go through these chronic illnesses.
And for lymphoma, I also think the oncology community is doing a better job, even doing papers, right? We used to have cat lymphoma papers that had high grade and low grade and kidney, and at least now we're looking at intermediate and high grade gastrointestinal lymphoma only.
Yeah.
Right? And we've separated out the other anatomic forms and the low grade. Thank goodness, right? So I think now we're just getting better at prognosticating and looking at studies and things. So I think that helps the newer studies that are coming out.
Yeah, we're writing better papers. We're understanding that you can't lump everything together.
Right.
Just because you've got 30 cases of cat lymphoma doesn't mean they all go in one paper.
It doesn't?
Right? No.
Oh, okay.
Newsflash. No. Yeah. So those are all good things. So let's just. I know lymphoma is usually medically treated. So I'm looking at Yola, who's a surgeon, but he's yawning. We'll talk. We'll let Yola talk about other cancers in a minute. But so just to speak on lymphoma for a bit. What do you see as when you're talking to an owner whose cat's been diagnosed? Let's start with like the small cell low grade lymphomas. What do you tell owners in terms of prognostics, in terms of what their cat's going to have to go through?
So usually those are ones where we're going to talk about a combination of oral chemotherapy. So we have to talk to them about the ability to pill on a chronic basis.
Yeah.
So it's usually every other day Leukeran, chlorambucil with daily steroids. Usually they're going to be on those lifelong. And I tell the owners it's a reasonably good prognosis with, getting them into remission, which remission is defined as gaining weight. So the symptoms that they were associated, so it's usually some combination of they're going to no longer be vomiting, they're going to be eating normally, and they're going to gain their weight back. And usually most studies say that their average survival will be about 1.5 to 2 years. So not bad, never long enough when it's your own pet, but usually a very treatable disease. But I always tell owners this is like heart disease or kidney disease. You're probably not going to cure the cat, but we're going to treat it like a chronic disease. Live longer, live well, so we want them to have a great quality of life, but it's going to require chronic visits and chronic medication.
And a lot of that comes down to, because it is chronic treatment, will the cat accept or tolerate it? Right? Because there's still oral drugs there no matter what you do.
Yeah, but when I'm actually in the room with the owners, I usually tell them, like, this is not something that you're just going to take some medication and come back in 6 months. I usually say, we're going to take this step by step. So I'm going to start some medication, see you back in 2 weeks. Then we're going to do another 2 weeks, and then usually if they're tolerating it, the medication starts to spread out, and then we go to every 4 to 6 week recheck. So it's not as intense as the high grade lymphomas where you're seeing them weekly and then every other week. And so I say you can stop at any other point. We're going to stop and evaluate the pet, if they're not responding. And so this is not an all or none process, and we can see how they're doing. And I think a lot of owners like that. They're not buying 6 months worth of medication. They're going to buy 2 weeks, see how their pet's going to do. They're going to buy 2 weeks, see how their pet's going to do. And I think for a lot of owners, they're so overwhelmed that their pet has cancer in the beginning, but they're like, okay, I'm going to try 2 weeks. And then like, oh, I forgot, my cat, they're gaining weight. their blood work's okay. And then they come back, and then you're like, oh, now we're going to every 3 days with the medication. That's not so bad. And then they're on daily steroids. But, so I think you have to break it down for the owners, because otherwise they can get really overwhelmed. And I think that process tends to help with the owners.
Yeah, I really like that because it is overwhelming. And I also like, and I hope owners would like hearing that you can stop at any time. Yeah. It's not like it's an all or nothing thing. Yeah. Like you're in for all of it.
And I say the same thing for high-grade lymphoma when you're doing weekly chemo. I say, you're not going to pay for the whole chemotherapy. You pay each week as you go.
Yeah.
So why don't we start and see how they do? And then they're like, are you really giving chemo back there? Because my cat's not getting sick. And they come back then, they're like, all right, I'll do 1 more week. And then they're like, you know what? This is going really well. And then they're like, and the cat's gaining weight, and the cat's diarrhea is finally resolving, and they're not stepping in cat puke all the time. And so for the cats with high-grade lymphomas, that subset that are responders, that are going to be the one...
They can be really good.
They can be really, really good. What's crappy about the high-grade lymphomas are those subset of kitties that within the first month or two don't respond. But those are the ones that you're going to stop.
And you're going to know.
Yeah. And they don't lose the money because they didn't, they didn't buy 6 months worth of chemo, Yeah. So, again, I feel like that helps the owners.
Yeah. I think it does, too. I think it's I think it's a reassuring way to tell owners. And I think they feel a little bit more like they're in control.
Right.
Right? Because I think often chemotherapy kind of takes over, at least on the human side, it takes over you. Right now, it's in control. And I think a lot of people have known somebody who's gone through chemotherapy. What I was going to say. Right? And
it's been a horrible experience.
And it changes their life, and it drives everything in their life. And it doesn't have to be that way for our patients.
And I think it's really important, and this is a little bit like sort of the communication part of it, but I used to just sort of talk about lymphoma and just explain everything. But now I ask them, like, do you have any experiences with chemo? I'm like, I'm sorry if this is a little bit personal, or with your family or another pet. And they might say, sometimes they're like, my dog went through it. It was totally fine. Just tell me what I have to do. And sometimes they say, well, we had another cat that had lymphoma and didn't do well, and we're really, really scared. And so I think, they say investigate before you tell. And I think if you kind of unpack their feelings about it, it can make it a little bit easier to address what their concerns are as you explain this one for them.
Yeah. And you can apply that to other things, because I often use the same approach with owners with a newly diagnosed diabetic cat. Yeah. How many people know other people or other pets with diabetes, right? You can apply that approach quite often.
And I'll tell you, diabetes scares me more than lymphoma.
Yeah.
I'm like the fact that I would have to give insulin twice a day on schedule and
that's actually easier. So.
No, that seems way more scarier than cancer to me.
You have to inject them with something.
Yeah.
I think it's also the fact that people get quite a negative feeling about cancer in general.
Yeah.
So, and that has to do with environment too. They hear a lot of horror stories about cancer, and not only about chemotherapy, but just, we're going to die. And it's different for other disease categories. So, for instance, if people are diagnosed with heart disease, oh, really, that's too bad. We know that an animal has of atrial fibrillation and will die within a couple of months. So cancer patients often have a much longer survival, but people will treat the arterial fibrillation much earlier than they will treat.
My husband's an internist, and I often say, well, what's the median survival time for that medical disease? And he's like, well, I don't know. I was like, but everybody comes into an oncologist and they go, how long's my dog going to live? How long's my cat going to live, doc?
That's a good point.
It is. It's really frustrating. I used to actually... About 5 to 7 years ago, when I started to first do social media, I almost took it personally that people were like, oh, cancer sucks. Because I felt like they were saying to me, because I love what I do. I love being a cancer specialist. And then I realized they weren't saying, Sue, what you do sucks. Yes, cancer does suck, but I still think what I do is really special, and I love that I help people and pets get through a really, really crappy time in the family, in the whole family experience. But they're not saying what I does suck. Cancer does suck, but I still think what we can do to help pets get through cancer doesn't have to suck. But it is interesting that there are so many other diseases, whether they're neurologic or, some respiratory diseases that are really crappy, saddle thrombus in cats, right? That are just so crappy, but people just, cancer, it's the worst. And I'm like, no, there's some cancer is really, really treatable, and the cats have really great quality of life.
It's not one disease.
Right. Yeah. It's many diseases with a really crappy title.
Yeah, yeah. Well, it has been a lot of fun having you with us, Sue, finally. And our time has flown by so fast. I can't believe it.
It is crazy.
Mm-hmm. Yeah, it's a time-shifting thing, I think, really. When you get talking to somebody that you really like talking to, or it's a really good subject, time just flies by.
I know, and oncology is the best subject.
Absolutely,
ever.
Yes.
Thank you for having me.
Oh, thank you for coming. And the good news is we'll have you back in 2 weeks.
Yay! Yay!
For our next Purr podcast.
And I'm sure it'll go just as fast and be just as interesting. So tune in next time for Dr. Sue.
The opinions of this podcast are those by Dr. Susan Little and Dr. Yola Kerpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page @Purr Podcast. Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Yola Kerpenstein is a diplomat of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Yola works currently at Hills Pet Nutrition. You can follow him on social media with the handle @GVETSX.